joining me today and every Monday is Dr. Timothy Bray, UTD EPPS professor and director for the Institute of Urban Policy. Dr. Bray, I'd love if you could just give a brief explanation of your COVID-19 dashboard that you'll be pulling COVID-19 updates from every week.
Great. Thanks for having me, Dani. Yeah, we want to talk a little bit about our dashboard today. Our dashboard came about because of the vast amount of confusing and sometimes conflicting information that we face in the light of a health pandemic like COVID. One of the great problems that we faced early on was that many of our numbers were tracked by counties. But most of us don't just live in a county, we live in a region. And a great example, the city of Richardson, which is right on the Dallas County-Collin County line, when Dallas County shut bars and restaurants and Collin County didn't, residents in Richardson could go either way, even though the data was only tracked by county. So we thought it was really important for us to get a regional picture of what's happening in North Texas.
Thanks, Dr. Bray. This dashboard is truly remarkable. I know our university uses it, and you've explained multiple times that so many other schools and other businesses have used this amazing resource. And in later weeks, we'll actually talk about what other statistics and other information your institute provides. But for now, could you just give us some COVID-19 trends for this past week?
Sure. So what you'll see on our dashboard, from left to right, we track three major pieces of information, four if we count vaccinations, right? On the left-hand side of the screen, you have case information. And it shows us, as of the 24th of October in North Texas, which is a 13-county region that we track, we've had 14.6 thousand deaths and 1.15 million cases since the beginning of the pandemic. More importantly, what we track in the three boxes below are trends over the last week. So new cases, these are folks who have reported a lab-confirmed positive COVID case. In the last 7 days in North Texas, we've had 10,862 new cases. This is down 31% from last week's 15,785. We also look at deaths, 346 this week in North Texas. Down 22% from last week's 444. And then I think a more relevant measure for a lot of folks is active cases. This is the number of people who are out and about in North Texas. Most of them are, frankly, sheltering at home, who are currently actively sick with the coronavirus. 28,272, down 20% from last week's 35,296. Now I'm going to not click it, but I'll draw attention to this button at the bottom. Each of these panels allows you to click a button and go more in depth with the data. The center panel shows us what's going on with hospitals. And remember, early in the pandemic, there was quite some concern that if the virus was left unchecked, it would spread rampantly and people would require hospital services to the extent that it would overwhelm our capacity to serve. So from day one, we've been tracking our available capacity in North Texas. Now, this is a slightly larger region. This is the North Central Texas Trauma Regional Advisory Council, of which our core North Texas community, especially our core four counties, are embedded. So 13,000 total beds, 12,000 patients gives us an occupancy rate of 89.9%. ICU beds, 93.9% occupied. Our ventilator utilization is under 40%. We're at 36.5. That number has typically been down like this. The yellow band that you see shows us what's been going on in the last 7 days. So for all three of these indicators, you can see that we're down from where we have been over the last 7 days. And finally, on the right-hand side, testing information. This is positive COVID tests in the state of Texas. 7-day average, we're looking at a 5.7% positivity rate. That number has been as high as 8 or 12%, depending upon where we're at in the pandemic. Total tests administered, 42 million tests in the state of Texas. And then finally, at the bottom, you've got your vaccination status. And again, for North Texas, 62% of our population age 16 and up is fully vaccinated. Age 12 and up is fully vaccinated. Almost 71% are partially vaccinated. So this is your sort of up-to-date, as of, in most cases, as of yesterday, data for North Texas. And Dani, to answer your trend question, we are down precipitously over the last several weeks. We have seen the numbers coming down, and this somewhat lines up with what other countries have experienced with the Delta variant. Delta variant had a fast burn rate, meaning that it was highly contagious and went through the population fairly quickly and then burned itself out, so to speak, in that we hardly see anywhere near the number of cases that we were seeing back in late July, early August, and September.
Thank you so much, Dr. Bray. What does this mean for our community? The trend is downward. Can you tell us a little bit more about maybe, I don't know if it's action items, but kind of what people can take from this information?
Yeah, that's a great question. The trend is down, but the cases aren't zero, right? We have 28,000 people sick with COVID-19 right now. I think the takeaway is we have to continue to be vigilant. We know that that vaccines work in that they reduce the likelihood of getting sick. They don't eliminate your risk, but more importantly, they reduce the severity of the illness if you get it. Now, we still do have people who are vaccinated who die from the disease. More often than not, these are patients who have other comorbidities, other co-occurring health conditions. General Powell is a great example. He had other health conditions that caused complications with COVID. But for the most part, we know that COVID-19 vaccines reduce the severity of illness down to the fact that many people who test positive did not know they were sick. They maybe had what they thought were allergy symptoms. So vigilance is key. If you are sick, if you think you've got a cold, get checked and find out, because the disease is still contagious. We have to be ever vigilant in keeping these numbers down.
Well, thank you so much, Dr. Bray. Join us next week where we'll give another COVID-19 trend update and share some interesting data that the Institute provides for us. Thank you so much, Dr. Bray.
Thanks, Dani. Have a good week.